If being a dermatologist is one of the most appealing careers in the different fields of medicine, well, on today's episode, I will be talking to one Dr. Hosea Wawero, and he's going to tell us about his life as being a dermatologist. You're watching Smart Careers with me, Shiro Kinyanjui. Thank you for keeping it Smart Careers. I'm now joined by Dr. Hosea Wawero, and he's a dermatologist, a very known dermatologist right here in Nairobi. Well, he's going to take us through his life journey as being one. Karibu sana, doctor.
Thank you. Thank you. It's nice meeting you.
Yes. So maybe you could just take us through the term dermatology. What does it mean?
Basically refers to the study of skin and skin diseases and related organs. That's right, yes.
What is the nature of work of being one?
The first and probably most important thing for people to understand that somebody has to be a medical doctor before they specialize into dermatology. Mm-hmm. So you don't leave a high school and go and do dermatology as a doctor. No. You specialize after having qualified as a medical doctor. Okay. Yes.
Oh, so it's a process.
It's a process, yes.
How long do you have to?
Medical school obviously is about 6 years. Then of course is 1 year of internship, maybe another year of general duty like a medical officer. Then after that, you go and specialize in medicine, internal medicine. Mm-hmm. And then after that, then you can do dermatology. Mm-hmm. So it's a fairly long process, but it's exciting. Mm-hmm. Yeah.
Are there different fields of dermatology, or is it just specified as one?
No. There are several fields actually in dermatology. Mm-hmm. Dermatology per se has something like maybe 4,000 diseases. Wow. That's a big number. But apart from the medical diseases, there are also surgical things that the dermatologists, of course, will operate on the skin. Mm-hmm. Operate on the skin first when they are looking for a diagnosis, which does not look obvious. So you get a specimen of the skin and then you go and process it in the lab. Mm-hmm. And that will give you a clue of what disease it is, and also possibly a clue on what treatment to use. Then, of course, there are those sections where you correct defects. Not as much as plastic surgery, but, defects in the skin. Mm-hmm. Then, of course, now a very big field that is the sort of cosmetic dermatology. This is where somebody probably doesn't like the way they look and they want to change and whatever. That is cosmetic dermatology. Mm-hmm. Then, of course, there are other sections like immunodermatology. Those are diseases that affect the immune system of the body and appear on the skin. Mm-hmm. So you can have someone also super specializing in those ones. Mm-hmm. Immune dermatology. Mm-hmm. You can have diseases of the hair, diseases of the nail also, diseases of the mucous membranes. Mucous membranes is where you're talking about like the genitalia, you're talking about the mouth, you're talking about the nostrils, you're talking about the eyes. Mm-hmm. Okay? Yes. So,
and where do you fall?
Me, I fall in the field of medical dermatology. Mm-hmm. My field is basically dealing with disease of the skin, mm-hmm. including cancer of the skin.
How do you come about, going about a procedure?
When we are doing a procedure, and a procedure here we are talking about, say, doing surgery on the skin, mm-hmm. it's just like you do surgery in any other organ. That you first of all have to identify what it is you want to do. Is it something you want to remove? In which case then you are removing it, and in the process you are also treating the patient by removing it. Mm-hmm. Is it a specimen you want to get so that you can now go and analyze it better in the lab? Mm-hmm. That's different. So you normally scrub the skin. That is, you normally would have a sterile area where you are doing this. Like in our offices, you have a sterile room, that's an operating room, or in theater, where everything is sterile. You have to remove the suits and the ties and the charts and choose and wear special things, so that when you are doing that, then you are not exposing the patient to other infections. Okay. So the patient is safe there because you have basically cut off the avenues from which they could probably get infection. And then, of course, then there are the instruments that you would use, just like you would use in any other operation in theater. Yes. But the instruments also depend on where you are also doing the operation. Yeah. If it is along the nose, they are very, very fine instruments. If it's around the back side, where the thing is a little bit thicker, you are using a different type of instruments. But yes.
So how many years have you been in the field, and what actually inspired you to become a dermatologist?
Yes, I've been in the field for many years, actually getting almost to 40 years. Many years ago, I was working in a district hospital as the only doctor. In a district hospital which was supposed to have 5 doctors, but I was the only one. And then, of course, there were many other clinicians, many clinical officers, nurses, and other people. And if they got into the problem, they would normally come over and ask the doctor. I could solve many of the problems, but skin problems were extremely difficult. And I felt very, very challenged. That I have been to school, and these people expect me to know so much, but I do not appear like I'm giving them a lot of lead. So I said, this is what I want to do. That's how I got into dermatology, and since then I have never regretted. And I have enjoyed it, virtually every bit of it. Yes.
So what are the pros and cons of being a dermatologist?
I can only imagine actually about the good things. First is exciting. You are exciting because dermatology is probably one of the very, very few specialties where a doctor will see patients of all ages, from the newborn to the one who is probably 110 years or older. Okay? Yes. And in between, you see males, you see females, you see pregnant ladies, you see old men, old women. So basically, it's a full spectrum of the whole human body. That in itself is exciting because depending on the age, there are some diseases that are specific for some ages. Yes. And there are some which are a little bit more common for other ages. So in that way, it's exciting. The only possibly con is that you have to keep up. You have to read a lot because there are new discoveries, new things being found, new drugs being found, and you have to keep up with them. That sometimes can be a challenge. Yes. There are very many journals to read, many conferences to attend, but that is part of the excitement, basically.
What are some of the skills or interests someone should have in order to become a dermatologist?
Must be somebody who has a very, very keen eye to detail and an listening person, somebody who can listen, and somebody who can decipher information. Because a patient may not necessarily want to tell you something, but you are supposed to infer and ask questions depending on what it is they are saying. Because many times the patient isn't sure exactly how you are going to take their story. So they are testing you, and you can see with some little bit of experience that the patient is holding something, and it is you as a doctor now to sort of get it out so that you can get a diagnosis so that you can also assist them. It needs to be a people person. Somebody who is friendly to people. Somebody who doesn't get easily upset. Because there are patients sometimes who can be a little bit irritating. But then you realize that they are unwell and they are coming to seek assistance, and you probably don't get too upset about that, yes. Then the dermatologist must be somebody who will be able to translate the science they know into simple language, because a patient who doesn't understand about their theme is unlikely to use the medication that they are going to be asked to use. So the dermatologist must be able to convince their patient that the treatment that the doctor is giving is going to be able to do this and this and this, and is going to achieve this, this, and this benefit. Yes.
We take a short break, and when we come back, we continue with our topic on dermatology. But before that, our encouragement segment. Stay tuned. Welcome back to Smart Careers, and now we continue with our topic on dermatology. So about the skills, when should one develop such kind of skills? Is it something that they should get from school, or is it something that should come from inner self?
These are things that you learn as you grow up, as you go to school, as you do your professions. So I don't think they are innate things that somebody is born with. No. These are things that somebody probably just acquires as they go through school and as they develop.
And what are some of the challenges now you as a dermatologist face through every day?
Some of the challenges, basically the unavailability of maybe facilities. Because there are some facilities that you may require that probably are not easily accessible. Or if they are, they will probably be terribly expensive. There are times that you want to put a patient in a hospital and then they cannot afford to be in a private hospital. And then you probably have to send them over to a public hospital where the facilities are probably a little bit stretched. Yeah, there are very good doctors, of course, in the public hospitals, but their facilities are stretched because of the numbers that they are seeing. So that is itself a challenge. The other challenge would be that we tend to see very many patients, also because there are probably not too many dermatologists also. Although most of the patients we are seeing are patients who also have seen several other persons, including even some of our other dermatologists, because patients are always looking for second opinions.
Yeah, second opinion, yeah. You as a dermatologist, do you always feel pressure to have perfect skin?
No. One of the things you have to appreciate is that we are all made differently. And we are all same, yet very, very different. You are given something by God, and the best you can do is probably look after it, care after it. Yeah. If you want to change completely, like some people say they want a makeover, that becomes an issue. And very often you make mistakes, and very often you get to catastrophes. And we do that, every morning, every afternoon I'm seeing patients who have tried to do something else. They've tried either to bleach their skins to look maybe more fairer or whiter, and then they are messes. Because many times it's very, very difficult to reverse that. Yes.
Do you think the products that we have are in supermarkets, in the beauty shops, what role do they play in making our skins, unfavorable?
It's extremely sad because the beauty industry is something that is evolving. It's something that is increasing by bounds because the pressure to look well or so beautiful is on virtually almost everybody. And there are many, many people who are making products to pretend that you are going to achieve that mystical figure or look somebody has. Maybe they've seen somebody on TV who looks nice and fair, but they do not remember that or know that a lot has gone back. Some of them use a lot of makeup. Somebody aspiring to be like what they saw on some magazine or some film, they tell you, no, that's not the reality. The reality is you on your feet. But nevertheless, having said that, we also encourage people to have a balanced diet, have a lot of exercise, and know that there are things that you inherited from your parents, and sometimes you cannot change. You can probably maintain them well, but you probably cannot change them a lot.
So how do you deal with a person or a client who is unsatisfied of the results after you have done maybe something?
The important thing is when you are seeing a patient is that we want to give them realistic expectations. We don't want to say that we are going to make you into a model. No. Work with what you have so that you can feel good about yourself. We don't want to change you completely. If you have a disease state, yes, we want to remove that from you. But then, depending at what stage you have come and what damage the disease has done on you, there are things that sometimes you cannot reverse. So we want them to accept the final figure, which is probably at the best that you can get to, and tell them, beyond here, I think we are now going to be dealing with the unrealistic expectations, which can be bad. So the important thing is the patient must believe in themselves and believe the doctor. And hopefully they've been convinced by the doctor that what the doctor is doing is right for the patient. Of course, that cannot be done by a doctor who has good experience. They've gone to school, they've seen maybe several cases, and they also consult with other doctors to know what is probably best to do in any particular situation.
So, and how competitive are the programs in reference to now schoolwork and the job market in dermatology?
There's still a lot of need for more dermatologists, and we are encouraging the young doctors to come up. There are great opportunities, great benefits, but somebody who's probably keen for money maybe should not be getting into medicine. Should be going to do something else. Because there are several other things you can do where you probably make more money. But if you choose in medicine, you want to choose something that probably excites you all your life, gives you joy, you are passionate about it, you like it, you are happy. Yes. In the process, if you make some money and you are comfortable, you are still very blessed.
And if one to venture into private practice, what are the requirements that one needs to know that this is what I'm going to face?
To be able to open a private practice, you need to be registered as a doctor. You need to have a license from the Medical Practitioner and Dentist Board as a specialist. And then, of course, they need to come over and inspect your premises, that it is up to what you are being licensed for. And you need to renew the license every year. The other thing is you also need to have continuous professional education. You need to keep up. Before you are licensed, they need to know that, yes, you've been reading throughout the year. You just not, got a license and gone and to sleep.
How will they know if you've been reading through the year?
No, when you are being asked to renew your license, you have to give evidence that you've been attending conferences, you've been attending courses. Yeah. This is probably very, very good for medicine because then it means that the doctor you are seeing is a doctor who is keeping up with the medical education. Yes.
What about now the equipment or whatever you use? How much or actually now, how do you even get started to get those machines?
To start a private practice is really not expensive, I say. The most expensive item is you, the person.
It's your figure.
Yeah, it is you as a person and how much passionate you are about it. The equipment you need depend on what type of procedures you want to do in the office. In our practice, we are lucky in that we have a very well-equipped theater, Upper Hill Medical Center. So you do not need to have a lot of little equipment around your office, which makes it cleaner and easier to maintain. Because medical equipment sometimes is very, very sensitive. And you need to upgrade it every so often. So if you are having personal equipment, it becomes cumbersome. Yeah.
Like how many procedures do you perform in a day?
We don't talk about a day, basically. We talk maybe about a week because we have one theater session every Friday. The morning is just dedicated for theater work. So we'll probably be doing about maybe 10 procedures.
10 procedures
About.
in a week?
About a week, yes.
So on both lower and the higher side, how much does a procedure cost?
That depends. It can be probably maybe just a few thousand or maybe a lot of money.
Depending on the procedure.
Depending on the procedure, depending on how much time you're using.
So what is that one thing that people should know now about taking care of their skin?
The most important thing is that you must have a balanced diet. The other thing is also having adequate rest and having positive lifestyles. Okay? And doing things that don't stress you. Okay? The other important thing is knowing that you are given a body by God. Just look after it. Don't try to change it. Look after it. Okay? Yes.
For someone out there who wants to become a dermatologist, what would you advise them?
Somebody out there means that you have to have very good school grades to get into medical school. You get into medical school, become a doctor, and then after that, then come over. We'll train you to be a good dermatologist. Yes. Yes. Thank you.
The patient will come from this side, be brought by somebody. The patient will come here, all dressed up, and then they lie down. Depending on where you're going to be operated, so the positions differ. They can lie on their left side, on the right side, on their back, on their tummy. So you cover the patient and you only expose the place that you want to operate. Yeah. So you switch on your lights. These are the operating lights. We are going to control it to where maybe you say we are operating at the shoulder. We are going to point exactly where you are operating. So just put it there and make the patient comfortable. Then you put this patient on the monitor. Because of the nature of the operation, this patient might be nervous. Yeah, you want to see how they are breathing. You put on your machine and you put on this gadget of the patient. This one we call SP2. It will check the amount of oxygen in the system. That sound is my heartbeat.
Okay.
Yes. To show you, this is 96% of oxygen in the system. My heart rate is at 98. To keep on fluctuating, since I'm talking, yeah? The patient is moving, is talking, the heart rate. And even this will keep on fluctuating. But there is a minimum level. It should not go beyond 90. The machine is going to alarm. So even the surgeon, when they are operating, they will just hear that sound and just look at the monitor. What is happening to the patient? But there will be somebody monitoring the patient. This is betadine. Then they can open the valve. And now start scrubbing. This is what we call scrubbing now. Scrub, come all the way, and it means onto the elbow. And then down. Somebody will tie their back. They can't tie their back. Yeah? And then they are given the glove on whatever side they want. Now they are ready to go to the scrub nurse and the patient. Yes. That is the process.
You can send your feedback on 20058. You can also send me a comment on my Facebook page, that is Smart Career. If you would like to appear or advertise on my show, you can do that on smartcareer254@gmail.com. Till next time, I have been your host, Hiroki Nyanjui.